Alrighty. Let's see, are we live? Awesome. Gonna go ahead and wait for a couple seconds so people can join us, and then we'll get started. And be sure to share this to our preferred page, so all those KC people can stay in the know.
Yeah, don't forget Kansas City.
And Topeka.
And Topeka.
So, yeah, let's see if I can get the feed to pull up. I don't know why. Let's see. Courtney, are you seeing it live on your side? Mm-hmm. Oh, there we go. Oh, I'm live on preferred. Cool. Well, we'll just share it to advanced. Awesome. All right. Today's Facebook. Give me 1 second. Post. Awesome. Okay. Hey Meilon, how's it going? We'll just wait just a few more seconds since I accidentally started it on the wrong page.
All right.
It's fine, we're all one company, we share here. So, okay. For those of you who are joining us, thanks for taking a few minutes out of your day to share this this afternoon with us. We are going to talk a little bit about occupational therapy. My name is Regan Ennis, and I'm the marketing coordinator for Advanced Physical Therapy and Preferred Physical Therapy. And
hi, I'm Angela Gerstenkorn. I'm an occupational therapist at Advanced Physical Therapy.
Awesome. So like I said, today we're going to talk all things occupational therapy. We've got an expert here with us today, so I think that it's great. Thank you for joining us.
You're welcome.
Yeah.
Happy to be here.
Awesome. So tell me a little bit more about what occupational therapy is and maybe what some of the differences are between physical therapy versus occupational therapy.
Sure. So everybody hears the word occupational and they think we're going to get you back to work, which we can do that, but occupation just refers to how you occupy your time. So it's not necessarily a job, although that can be included in that, but occupation, how you occupy your time, it could be everyday activities, getting back to golfing, getting back to taking care of your grandkids, cooking, normal activities of daily living like getting dressed on your own, those sort of things. So we really work across the lifespan from kids on up, getting you back to doing the things you need to do and want to do. And we try to use everyday activities in that.
Right.
In an outpatient clinic like Advanced Physical Therapy, you're going to see the occupational therapist more for the upper extremity injuries, so really shoulder down. You can still see a physical therapist for those things, but we tend to specialize a little bit more in the shoulder down.
Absolutely.
Down on the hand.
Absolutely. So maybe what are some common diagnoses with that you see maybe on a day-to-day basis, and how those can affect people's day-to-day lives, like you were saying, how it treats occupational everything from the morning when you wake up to when you go to bed.
Sure. So nerve compression and tendonitis tend to be the top two. So carpal tunnel syndrome, everybody hears that all the time. We're on our computers a lot. And then some people get it from doing heavy work activities, drilling, and those sort of things. So everyday activities, like I'm kind of a new mom, and so there's something called mommy's wrist, and you get that tendonitis in your wrist from picking up your baby, and I recently discovered how uncomfortable that is. So we treat that, and so getting somebody back to being able to pick their baby up again, because if they're in too much pain, they're not going to be able to pick their baby up safely. So that impacts your role as a mom. We see people after fractures, after surgery, getting them back to moving and getting their strength back again. We see people after they have a stroke, trying to get that arm moving again and get the strength back so that they can do whatever activity they're looking forward to doing again.
Sure thing. I think from experience, I actually had tendinitis in my hand, and it was from overuse of technology.
Oh, yes.
Which, who would have thought?
That mommy's wrist has kind of turned into a texture's thumb now. So
yeah.
We see a lot of that.
Very similar, yes. So can you see just adults, or what's the age range that you see?
So we see from birth on up. You'll see occupational therapists in the NICU. You'll see them in skilled nursing facilities. So at Advanced, we also work with pediatrics. So we work with kids as well. So developmental delays, reaching those milestones. We can work on handwriting. If there's decreased mobility in the arm due to stroke or cerebral palsy or anything like that, we can work on that as well.
Yeah, definitely. So anyone could really benefit from occupational therapy.
Yes, definitely. Like occupation can refer to, for a kid, it's more play in school. So they're not going off to work, but their occupation, the way they're supposed to occupy their time is through play and through going to school and things like that. So we work on getting them back to those activities.
Yeah, definitely. Looks like we have a comment from Aaron. Thanks for joining us, Aaron. I know you're a busy guy, so we appreciate you taking some time out of your day to talk with us today. He says, smart gloves have saved his wrists for years. Highly recommended. Oh, very nice. Looks like we've got quite a few viewers. For those of you who are just joining us, we wanted to say welcome, and thanks for taking some time out of your day to join us. Today we're talking about occupational therapy, and I've got Angela here with me, and she is an occupational therapist here at our Advanced Clinics in Wichita. We do have occupational therapy across our company, so that's something that's really great about Advanced and Preferred Physical Therapy, is it's not just unique to one sector of our company. It kind of it goes across the board, so that's great. And I know we have some very talented therapists up in Kansas City and in that area as well. So let's see, we've talked about lifestyles and how occupational therapy is really about bettering the lifestyles of people, getting people back to where they want to be. What can you tell me about some common ailments that you see? Maybe what the most common complaint is that people come in that you treat?
Probably back to that carpal tunnel syndrome. We see a lot of that. You can get carpal tunnel syndrome through many different ways. Really, what's going on is we've got a big nerve that runs through our forearm here, and there's a very strong ligament here, and when the tendons get swollen, it pushes on that nerve, and that causes a lot of pain, causes some numbness and tingling, causes decreased strength. A lot of times you'll feel it more at night. And like I said, it can be caused through repetitive motion, so constant typing. It can be caused by how you're positioning your wrist. So I also had issues with this from holding my baby. I was holding her with my wrist really bent like that. So you can get it from many different ways.
Yeah, I feel like people who work in the aircraft industry, who are working on parts, or maybe they're placing certain pieces in a repetitive motion, they would be someone who could definitely benefit from occupational therapy.
Definitely. That repetitive motion, pinching, gripping, having your hand in a certain position for a long period of time, all those definitely contribute to carpal tunnel syndrome.
Yeah, absolutely. It looks like Whitney has a question. It says, can you refer yourself to OT, or do you need a referral?
No, you do need a referral by a doctor, or a nurse practitioner, or a PA, or a chiropractor. You need a referral to see us.
So at what point should you go to your doctor when you're experiencing pain or anything like that?
Really, the sooner the better. The sooner you come in with symptoms, the quicker we can help you recover, especially when it's impacting your day-to-day life. If you're having, like with carpal tunnel syndrome, it often affects people at night when they're trying to sleep. So if it's impacting your sleep, if it's impacting your ability to do work, or do the activities you love to do, anytime that it's impacting your life like that, definitely come in.
Definitely. I know you can have surgery for carpal tunnel. At what point does occupational therapy, when does carpal tunnel go so far, where it can't be treated by occupational therapy, and can you go to occupational therapy after your surgery?
Yes, it varies. It depends on how long that compression has been going on. It also depends a little bit on the anatomy of the person in particular. So a lot of the times we'll try conservative therapy first, and if that doesn't work, you'll be referred on back to your doctor, and they may perform surgery. And then coming to therapy after surgery is great. We can start getting you moving properly. We can teach you some exercises. We can also educate you on ways to help prevent pain in the future, and help you return back to that strength after surgery, and just help give you an idea of how to progress yourself after surgery.
Right. Is full recovery possible after carpal tunnel? suffering from it, or maybe after surgery?
Oh yes, I've seen great results after surgery. They've really perfected that surgery quite well.
Awesome. As far as youngsters go, what sort of things can occupational therapy do for pediatrics?
So we work on a lot of different things when it comes to pediatrics. Really working on some fine motor skills, so sometimes we'll work on handwriting. We've worked with kids who have lost some of the motion and strength in their arm after a stroke, so trying to help return that, get the motion back for that, help them get back to playing and being a kid again.
Right.
You know, if they need to get back to being able to dress themselves again, we'll work on that. Really, whatever it is that they need to do in their everyday life, that's what we focus on.
Definitely. Let's see. If you could give us your best experience with a patient, just in general, maybe milestone-wise, how far they've come. Can you give us an example of that?
Oh, there's been so many great patients. One of the best I saw was a severe nerve injury that someone had suffered after a motorcycle accident, and it seemed like none of his muscles were going to work because that nerve was injured. And we worked for quite some time, a few months, and slowly the muscles started working, and we started strengthening him, and he was able to return to his job, and that was really exciting to see. It was a long road, but he did so well.
I'm sure to see any of your patients go back to their normal everyday routines. I mean, it's a sad goodbye once they don't need you anymore, but it's a huge graduation accomplishment after that.
It is. I always tell them I hope to see you again, maybe not here, maybe at the grocery store or something like that, but you know, it's always exciting to see them move on and not have to suffer from that pain or that decreased motion anymore.
Sure. Out of curiosity, what sparked your interest in occupational therapy?
Oh, well, my sister actually received some occupational therapy services in home when she was young. And then my grandma had a wonderful OT when she was at a skilled nursing facility for her hip fracture. And so that really got me interested in it. It was just amazing to see the therapists work with the patients and develop such a good relationship with them and really get to know them and what they wanted to do and what they wanted to return to. And it's just so fun to find what is the true meaning for this person and what really it speaks to their heart and get them back to being able to do that again.
Absolutely. Well, we're lucky to have you.
I'm so happy to be here.
Yes. What can you tell me about maybe some other common ailments, maybe less common than carpal tunnel, but some things that you maybe see on a day-to-day basis that our viewers might relate to?
So arthritis is another big one. Really, honestly, we start getting arthritis. We all probably have a little bit of arthritis in our thumb at this point, but we see a lot of arthritis in the thumb, and that causes so much issues. I've seen people have issues being able to do their cross stitch again, quilting, being able to hold a book, do their gardening. And although we can't reverse the arthritis, we can definitely help with the pain. We can help returning to your activity, even if we have to modify it a little bit.
Yeah, absolutely. Well, I mean, I think we all have at least known someone whose life has been changed by some of these things that maybe they didn't know were treatable.
Yeah.
One of the things we say at Advanced and Preferred is that we do treat that. And I think that that's something we hope to gain by these Facebook Lives, is being able to educate those around us. So is there anything else you would like people to know about occupational therapy, maybe in general or more specifically?
You know, mostly it's just kind of nice to highlight what we do and just the little bit of differences between occupational and physical therapy. There is a lot of crossover depending on what setting you're in, outpatient, hospitals, things like that, but just kind of letting everyone know what the main idea is, and we're just trying to get you back to what you want to do. And again, if you're coming to an occupational therapist at Advanced Physical Therapy, it's usually going to be for a shoulder, elbow, wrist, finger, hand injury.
Yeah, absolutely. Well, if you're not joining us during the live broadcast, be sure to leave your comment down below just to let us know that you were watching. And if you have any questions after the live broadcast, maybe you're watching the replay, be sure to drop them in the comments below, and we'll get with Angela to have those answered for you. Again, we appreciate you taking the time out of your day to join us, and we will see you next Tuesday at 4 o'clock, where we will be talking about a different topic. But again, thank you, and thank you, Angela, for joining us.
Thanks so much.
Yeah, and we'll see you next week.
Thank you.
I don't know how to turn that. Rachel's on vacation.